tired. I am tired. I think it is very important we have been patient for such a long time. It's very important to be patient and follow all the protective measures for a little bit longer.
Tonight, doctors, nurses, first responders, and frontline workers are all pleading with us. Please don't let your guard down just because there are some doses of the vaccine here on our First Coast. Good evening. Thank you so much for joining us tonight. I'm Jeannie Blaylock.
And I'm Jeff Vallon. It's going to be some time before the vaccine is widely available to the public. And in the meantime, we're seeing the number of cases rise again here in our communities. Here's On Your Side's Kaylee Tracy.
2020 has been mostly a year with lots of bad news. But fortunately, there's some good news now that we have a vaccine and we can finally turn the corner.
It's a line we've heard a lot this year. 2020 hasn't been the best year, to say the least. But things won't be back to normal at the stroke of midnight on January 1st, 2021. Dr. Mobeen Rathore, chair of infection prevention at Baptist Health, says
things will get better. But hopefully by next year, this time, we will have enough people immunized in the United States that we can say, okay, now we can go back to how we were in terms of the normality of our lives in 2019.
Dr. Rathore says that timeline is based on how long it will take most of the population to get vaccinated.
We have to immunize a sufficient number of people, so if a sufficient number of people are protected, then you'll start seeing the impact. To get the real impact, you get to herd immunity.
He says that herd immunity for most vaccines comes when 90 to 95% of the population is vaccinated.
Then we can say, yes, we have some herd immunity and we can take a sigh of relief.
Rathore says hope surrounding the vaccine should not translate into letting your guard down.
We follow all the smart protective measures, face masks, social distancing, smart isolation. We continue to do those things. Otherwise, I think many people can get infected because they have this false sense of security because a few people have gotten the vaccine.
And one more important note Rathore wants you to hear.
Here's the bottom line. The vaccine prevents you from getting the disease, which means that you will not get sick. It does not prevent you from getting infection, which means you can still get the infection and give it to the others.
He says the Pfizer and Moderna vaccine studies looked at the presence of disease if participants got sick, not the presence of infection, meaning we're not sure yet even if you're vaccinated, you won't get infected. Another reason, Rathore says, not to let our guard down. Kaylee Tracy, First Coast News, on your side.